Welcome to this special show. NDTV and Duroflex coming together to advocate and raise awareness for better sleep quality and health. On our panel today, we have Matthew Chandy, Managing Director, Duroflex, Dr. Manveer Bhatia, Senior Neurologist and Sleep Specialist, Dr. Ashok Seth, Chairman Fortis Escorts Heart Institute, Head of Cardiology, Council of Fortis Group of Hospitals, and joining us is Ira Trivedi, Yoga Acharya. Thank you all for joining us on the program. Dr. Seth, so tell us more about the link between lack of sleep and our heart health.
You know, I think sleep is not a luxury. Sleep is a necessity. We must remember that. And for a long time, we've been emphasizing the risk factors for heart disease. And everybody knows that that's related to smoking, diabetes, obesity, hypertension, stress, etc. But can you believe it that we've actually excluded and not emphasized enough on the most important risk factor, and which is sleep? For example, if you just have to understand the fact that the heart is a muscle pump and continues to beat every second, multiple minutes, multiple hours throughout our life. And we just need to give it rest. After all, it's there. And do you realize that actually at night, when the heart rate goes down, when the blood pressure goes down, heart is getting a rest. It's getting rejuvenated for the next day. So that is the clear mechanism, and it's not just a hypothesis. It's actually a proven mechanism which prevents heart disease. And therefore, more recently, we've been emphasizing the fact that all this issue about, I'm all motivated, I'm actually an achiever, the less I sleep, the more time I have to achieve, is actually a real myth. Those who sleep less than 7 hours have a greater chances of heart attack and a greater chances of dying. And let me explain why. It has clearly been shown that inadequate sleep, there are 3 aspects of sleep that we as cardiologists emphasize and are very concerned about. One is the fact that lack of sleep causes increase in weight, is known to cause increase in blood pressure, is also known to cause diabetes, can cause inflammation of the arteries, and can precipitate heart attacks, even in normal individuals. In those who already have heart disease, lack of sleep itself can cause heart attacks, can cause heart failure. That's also recognized.
Right.
And thirdly, the quality of sleep correlates with high blood pressures at night. And if the blood pressure goes up at night, it is one of the clear predictors of bad outcomes in people. So high blood pressure during the day is not so bad. And that's the one which we are treating commonly. High blood pressure at night, when you're supposed to have low blood pressure, is a much bigger predictor of having heart disease and deaths from heart disease. And that's what happens in lack of sleep. And finally, there are sleep disorders like obstructive sleep apneas, which clearly relate to arrhythmias, which clearly relate to heart failure, which clearly relate to heart attacks and death. So we are actually in a conundrum saying and emphasizing now these days that sleep is most important, equally important as smoking, as obesity, as diabetes, as hypertension, to prevent heart disease as well as heart attacks.